Hey everyone, in this video we're gonna talk about the early signs of cervical cancer, and stay with us to learn more about this topic. Let's get started. Cervical cancer is the third most common type of gynecological cancer in the United States after endometrial and ovarian cancers. And cervical cancer has the best prognosis out of the three main gynecological cancers. And the peak incidence is around 35 to 44 years of age. In the early stages, cervical cancer is going to be asymptomatic, but the first identifiable symptoms of cervical cancer are likely to include abnormal vaginal bleeding, such as after intercourse, between menstrual periods, or after menopause. And menstrual periods may be heavier and last longer than normal. And another symptom is pain during intercourse, and you can see vaginal discharge and odor, because if cervical cancer lacks oxygen, some cells may die off, infecting the tumor. And this infection creates a foul-smelling vaginal discharge. And in the late stages, you can see lower back, pelvic, or appendix pain, and also leg pain. And you should always consider cervical cancer as a cause of postcoital bleeding. What is postcoital bleeding? Postcoital bleeding is bleeding from the vagina in women after sexual intercourse and may or may not be associated with pain. And blockage of kidneys can occur from cervical cancer. This is important because this blockage will cause urination to become uncomfortable and sometimes difficult. You can see frequent urges to use restroom without cause. And this blockage causes the main cause of death, uremia. Uremia often occurs secondary to bilateral urethral obstruction. And uremia is a serious complication of chronic kidney disease and acute kidney injury. It occurs when urea and other waste products build up in the body because the kidneys are unable to eliminate them. In cervical cancer, you can see bilateral urethral obstruction, and that can cause uremia, and that is the main cause of death. And affected individuals are typically asymptomatic during early stages of disease, like we said earlier. And in the late stages, you can see vaginal bleeding, pelvic pain, and or lower back pain. This is a quick summary. And this is the end of the video. If you liked it, please push that like button, subscribe to my channel, and see you on another video.